Hey guys, it's Dr. Justin Marchegiani here. Happy Friday. Beautiful weather outside, about 75 degrees. My wife was so kind. She came in and brought me in my nice little kind of quiche she made last night. It's got some eggs in it, some sausage, some vegetables. So I'll be having the snack here real soon, but wanted to check in with you all, see how you doing. Any questions pop up? Again, I got a new summit coming out this fall. So if you're interested, check out thyroidresetsummit.com. Should be up really soon. You should start subscribing. We get some phenomenal interviews. I interviewed Dr. David Jockers for the summit this morning and dropped some amazing knowledge bombs on the ketogenic diet and how it can help improve thyroid function. So check that out. We're going to have world experts from all over the place, names you've heard, names maybe you haven't heard, lots of information to help improve your thyroid health. So feel free and check in with that. All right, awesome. What's cooking, y'all? What's happening? Let me know. I'm going to pop up my little command center over here and see if any questions are coming in. All right. We got some coming in here already. Let me rock it over here. Perfect, guys. Gabe writes in, if I'm taking a daily dosage of your line of collagen powder, that's the true collagen with my smoothies, is it also necessary to drink bone broth? It's a great question. Collagen and bone broth are quite similar. I mean, bone broth's going to be a little bit different. It's going to be like you have the bones and then you let them sit, and then all the collagen or all of the, the collagen, all the nutrients from the bones, the marrow, etc., will go in to the water, and then they dehydrate that and make powder out of it. So again, the bones are going to be really good, really healthy, really good for like the gut lining and such. Collagen itself, like my collagen powder, is going to also include the hide of the animal. It's going to include the bones, the ligaments, the tendons, and then we get a whole bunch of proteolytic enzymes. We put them on top of that to process it and to help kind of pre-break it down and make it easy. A lot of other people use sulfuric acid to break it down. So I would say choose one or the other. I chose the collagen, primarily the collagen powder, for one reason. One reason is some people have histamine issues, and I deal with a lot of chronically ill, very gut-sensitive patients. So I chose the collagen powder because of the lack of histamine, so people that are sensitive can still handle it. So that's the main reason why I did that versus going like a Dr. Axe angle and doing the ancient nutrition bone broth. So I think they're both good if you can tolerate it. The bone broth's nice because you can kind of like put it in some hot water and you can just sip it, and it's kind of nice. Where the collagen is just really a good, nutrient support, or you can add it to your coffee. So I'd say either one's good as long as you can tolerate the bone broth, you're good. Hey there, guys. Hey, Sandra. You're right in my neck of the woods in San Antonio. Awesome. Shello writes in, please tell me anything for self-injury scars. With scars, I mean, a couple things you can do. Number one, you can always add vitamin C and or vitamin A retinol to that. That will help with collagen stimulation. You can, if they're relatively acute, or even if they're older, you can always do some silicone gel. There's a really good one called New Gel Plus on Amazon that has great reviews. That's great. Helps with the healing. It helps stimulate the fibroblastic activity and get that collagen going. Depending on where it's at, if it's on the face or somewhere more aesthetic, I would look at doing a good fractionated laser to stimulate the collagen, or maybe even a microderm to get the collagen or get the skin kind of evened out. Those could be some really, really good options. Glenn writes in, Dr. J, is C. diff without GI symptoms need to be treated? If so, what are the herbal options? Berberine, Sacro-B? Great question, Glenn. So off the bat, I would say Saccharomyces boulardii and berberines are going to be great. Oil of oregano is going to be great. My concern is you may have C. diff and something else. And there may be other things going on. So I would just keep that in the back burner. But yeah, I think that's a really good start. Hey, Spivey, how you doing? Great connecting with you last week. Amy writes in, what do you suggest to do for liver support or to help cleanse the liver? Awesome. So first thing is, without getting too nuanced, stop putting stress on the liver. So get organic. Solution to pollution is dilution. Enough good hydration there. That's a good first start. Then outside of that, we can use phase 1 nutrients, which are going to be B vitamins. They're going to be various tonifying and supporting liver herbs like dandelion and fringe tree and artichoke and silymarin. Those are great. And then on the phase 2 side, which is the water-soluble toxins now getting excreted, phase 1 is fat-soluble to water-soluble. Phase 2 is water-soluble to excretion. Now with that, we're going to use a lot of the sulfur amino acids, glutathione precursors like glycine, glutamine, methionine, taurine, Those are some good ones to start with. So I like those. Of course, if you're a little bit more sick, we may have to add in extra glutathione or even more binders, because sometimes we can liberate too many toxins and we need some binders to kind of help soak up that dead debris. So when we pull them out, they don't go hog wild and go everywhere. We can actually work on binding them up so we can get them out of the body better. Does that make sense? Okay. Nora writes in, Head Jay, have you heard about magnet therapy or about PEMF, pulse electric magnetic field therapy? If so, what do you think about it for gut issues? I think there's going to be some good benefit there. I mean, I've tried it before. I mean, I'm in relatively good health. So, I mean, am I going to see a huge benefit with that? Probably not. I have some doctors that I work with that use that therapy. I think it can be really helpful, especially if you're really inflamed. I'd say try it out. You know, try it out. Most important thing is if you have a great response, that's more important to me than anything else. So I think it's only could do help. I think it'll only benefit and help you. Quick question here on Facebook. Thomas writes in, most recent stool sample for was negative for ovarian parasites. Could it be possible that I still have... Could it be possible that I still have... Okay, hold on one sec there, Thomas. Could it be possible that I still have an infection? And what steps should it be to deal with it? Headaches every day, also 200 CBU probiotics. Yeah, I mean, you definitely could have some infections, all right? Anytime I see headaches, anytime I see inflammation, I always think the gut, I always think food allergen. So I think infections are very probable. So I think you have to look there and you have to make sure it's cleared out. If you've already done some infection treatment, I think it's good to retest to make sure that it is gone, because sometimes new ones can be burrowed in deeper and they have to come out. Hope that helps, guys. I'm going to pop up my Facebook on my browser here. That way I can just see what everyone's writing a little bit better. All right, cool. All right, keep on rolling here, guys. Do asthma inhalers contain steroids? A lot of them do, like albuterol. Typically, they're an anti-inflammatory, which kind of helps vasodilate because inflammation tends to constrict. So then it opens that up by putting out the inflammation. The problem is, doesn't get to the root cause. So keep that in the back of your head. Let's see here, Random writes in, hi, hey, Random. Rebecca writes in, what's your version of bio? What is your version of bio HPF? Last I emailed your company, never heard back, want to buy it. Yeah, so if you're interested in purchasing that, Rebecca, I think I saw your email come in this week. So if you go to my store at justinhealth.com/shop, you can click on the digestion or the gut category and you can see it in there. That's the GI Clear 2. That's a good one to look at. That's the GI Clear 2. And again, that one's good for H. pylori. Bacterial stuff, we'll do the GI Clear 1. For parasite stuff, we'll do the GI Clear 4. So if you have an H. pylori issue, that'd be a good first place to look. Hope that helps. Sandra writes in, what do you think about bracelets or necklaces for EMF protection? What do you recommend? I think they're beneficial. I mean, there's a couple. I have one on my phone right now. I have the Q-Link, and that's through, I think, Edward or Fred Tiller. He's over at Stanford. He created that one. So I have one on my phone. I also use it's a little cheesy. My wife makes fun of me, but whatever. I wear like a little holster and I just keep it on the side of my hip. That way it's not next to neurological tissue like my testes or whatever else, right? A lot of people, they keep it in that front pocket and that's going to be really close to your ovaries and really close to your genitals. So I would keep it away from there. That's why I keep it on the side. Hope that helps. The rest of his GI map test was negative. Glenn writes in, oh, okay. So yeah, that's a good sign. So I would do the Saccharomyces boulardii. I would do some berberines. I think that's a really good start. Maybe some oil of oregano or silver. I think it's a really, really good start. Just make sure the first 3 hours have been addressed. That's the biggest mistake most people make, is not addressing the first 3 hours. Awesome. Let me see. You guys are writing messages in so fast I can't keep up. I love it though. Can you suggest me any medicines with the name? Okay. Help me out with the grammar, guys. When I read it back, I sound pretty uneducated. Can you suggest me any medicines with the name? Okay. Let me see, Shello. You have to write me again. I'm not sure what you're asking for there. Okay. Got it. Another question, when are biofilm disruptors needed? Well, I tend to always add them in with the ginger. So if you're taking the ginger tea, anyone that's having sensitivities, I think ginger tea is going to be great. If you want the herbs to work better, ginger tea is great. So I think that's a really good first start from a biofilm disruptor. And then also silver is great as well. So I think ginger is really good to start. Reese writes in, hot flash, help, natural remedies. Well, there's a product I use that it doesn't really need testing, but for menopausal women, there's one called Feminescence Menopause that I use. That's phenomenal. Outside of that, we will support estrogen and progesterone levels accordingly, and we'll support the adrenals accordingly. Of course, get all the stress out, do all the full functional medicine workup to get all the stress dialed in. All right, Thomas writes in, most recent stool sample was negative. Could it be possible I have an infection? Also, what should I do? Headaches every day. How much is too much probiotics? Well, it depends. I mean, most companies, they're going to recommend anywhere between 2 to 4 capsules, maybe 6 capsules in their product line. It depends. Like Claire Labs has a certain amount per unit, maybe 25 million per capsule. It just depends on the company, but I'd say 4 to 6 capsules is pretty good for a good, like, proactive reinoculation dose after an herbal treatment. When is the best time to take charcoal for H. pylori die-off? Great questions, Charlie. 3 hours after food and supplements and 1 hour before. That way, when it goes in there, it's not going to bind up a bunch of food and supplements. The only exception will be if you're eating maybe some questionable food or drinking some questionable drinks. That'd be the only exception there. James writes in, Dr. J, just trying other modalities before I try the GI Clear products. What do you think about a combo Matula tea and ginger tea? I think it's good. I think it's great. I mean, I would use it in conjunction with the GI Clear herbs. Ginger's great because it's an anti-inflammatory. It's an anticoagulant. It keeps things moving. It's also a biofilm disruptor, which will help the herbs work better. That's part of the reason why I like it so much. Nora writes in, thanks, Dr. J. Hope you have a great weekend. Thank you so much, Nora. You as well. You as well. Rebecca writes in, also want to thank you for all the info. It's fun to talk with you. Found my new docs in the residency as a CMA. They turn up to us for a lot and they make a big difference. Well, thank you so much, Rebecca. Any questions, feel free and let me know. I love these conversations. I don't think there's a lot of people out there that put themselves out there like this. And, you know, it's like a little vulnerable because I'm getting all these questions on the fly, but I feel like I have a lot of information. I love interacting with everyone. So keep it up. I appreciate it. Charlie writes in, can you take resistant starch, either banana flour, for killing H. pylori and parasites easy? Great question. I mean, I think there's some good benefits with resistant starch kind of post-herbal treatment because it can provide almost like a prebiotic-like effect and feed some of that good bacteria. Sometimes if there's a lot of bacteria there, it can feed on that as well. The bad bacteria can, and it can create a lot of bloating and gut issues. So I would say play around with it to tolerance. As long as you're not getting bloated or gassy, I think it's fine. Also, when you consume, you know, when you're doing a clearing program, I think it's good that you up the carbs just a little bit because the carbs like the easier to process carbohydrates. Back up. The microbes like the easier to process carbohydrates. So adding in a little bit of the extra carbs can act like cheese on the mousetrap, so to speak, to bait the critters out. And then we come in and whack them. James writes in, H. pylori. Yep, I get it, James. Yep, my answer. It still stands. Charlie writes in, please get Daniel Hill on your podcast soon. Will do. I will reach out to Daniel. I talk with him every 2 weeks. So I think that he'd be a great guest. I'm also going to get him on my Thyroid Reset Summit as well. We're going to talk about the emotional connection with thyroid health. So you guys listening now, head over to thyroidresetsummit.com. The URL should be up soon, thyroidresetsummit.com, for some phenomenal thyroid info coming soon. Gabe writes in, my friends, 1-year-old twin boys have 2 episodes of seizures. Any idea what it may be? Oh, man. First thing is I would connect it to vaccines. All right. Vaccines potentially can create brain inflammation, microencephaly. That's number one. Number two, there could be some foods in their diet. There could be some pesticides. There could be some Roundup. Maybe they spray their yard with pesticides and chemicals. I would look at those vectors first. If there is a vaccine connection, there's a couple ways you can modify the schedule and just give 1 vaccine at a time and give no triple vaccine. So like a DTP or MMR, you'd break them up one by one. That's an option, and never vaccinate when your child is sick or has any immune issues. Number 2, you can do a modified schedule where you just wait. Number 3 is you can start giving less vaccines or not vaccine at all. But those are a couple options for you. Also forgot, ketogenic diet. Really get the carbohydrates down and really get more ketones. Ketone therapy and ketogenic diets have been used for over 100 years as first-line therapy against epilepsy and seizures. Roshan writes in, I noticed that even light exercise stimulates a lot of burping, even when I've been fasting for 12 hours. Wondering why it can happen. I do have mild SIBO. Yeah, sounds like you have gastroparesis, Roshan. Sounds like the food's sitting in your stomach way too long. You need to start, pre-cooking, crock potting it, breaking it down, nothing raw, everything peeled, everything mashed, get the HCl, get the enzymes going. What are the first 3 R's? Remove the bad foods. So for Roshan, remove the bad foods. If you have SIBO, you may want to go low FODMAP. Prepare the foods in a way, this isn't for everyone, but prepare the foods in a way so it's easier to digest. So peel or mash or use crock pot type of method. Number 2 is replace enzymes, acids, and bile salts so we have better digestive secretion to break down the foods. Third R is going to be replace the gut. Remove the bad foods, replace enzymes, acids, repair the gut lining, repair the adrenals, repair the hormones. Those are the first 3. That would include adrenal support as needed according to test, thyroid support as needed, female or male hormone support as needed, and of course, gut lining support if needed. Not every one of my patients gets gut lining support because just making those changes in the first 2 hours can sometimes help with that third hour on the repair and the gut lining side. Tiffany writes in, hey, Dr. J, quick Hashi question, almost in remission, past roundworms, lots of SUPs. Question, is it true that once you start a T3, T4 therapy, you never come off because of dependency on T3? Great question, Tiffany. I would say number 1, it depends on how much damage has been done to your thyroid by your immune system. If we can get some recovery going, typically I get my patients baseline stable, fix their infections, fix their adrenals, lock in their diet and lifestyle habits, get their blood sugar doing well, get their gut absorbing well, get them pooping and sleeping well. And then once we've been stable for 3 to 6 months, then we just gently dose down the glandular that we're giving. And we can see how your body comes to the rescue. There's some herbs we can do to help with the HPA axis. We can give glandular tissue. We can give nutrients. We can give upstream adaptogens to help. But again, it's going to be customized and it's going to be dependent upon how well you're adhering to all the recommendations I've made and how much damage has been done to your thyroid. How do you reduce gout flare-up? Well, number 1, you got to cut out the fructose and the refined junky foods and the inflammatory foods. Michelle writes in, please your FB account. Okay. What do you recommend for women who have a lot of pain during their cycles? I mean, that's a loaded question. Fix the adrenals, fix the female hormones, get the diet and lifestyle in place. Symptoms do not happen in isolation. The systems, so back up here. SSS approach. Stressors happen first. Physical, chemical, emotional stressors. Stressors over time cause the body systems to break down. System 1, hormones. That could be ATF or ATM. Adrenals, thyroid, female hormones, or adrenals, thyroid, male hormones. System 2 is going to be digestion and infections. System 3, detox, nutrients, neurotransmitters. The systems start to break down, and then the symptoms are over here. So you're just talking about one symptom. Conventional medicine exists like this. PMS, birth control pill. Headache, ibuprofen. Oh, by the way, that kills 20,000 people taken a year correctly. Careful with that. Number 3, depression. Let's just say Paxil, Lexapro, Zoloft, right? Focus. ADHD, methamphetamine, Strattera, Ritalin, Adderall. I mean, we can go here all day. It's a pretty easy model, right? It's like, drug symptom, this and that. And then we can even do it in natural medicine too. We could say, headache, magnesium, curcumin. Now, here's the thing. I don't have a problem with that model as long as we're going upstream and we're fixing the root causes, right? System issues, stressor issues. So when we talk about a female hormone issue, right, we may say, okay, chase tree, or we may say, let's give you shepherd's purse or blue flag. We may give you an herb, but or maca, but we're also going to go upstream, look at the stressors, look at the systems, and then also look at the underlying stressors. So that's kind of how I draw a line between most natural practitioners and even MDs and myself. It's really a much more holistic upstream approach. Hope that question helps you guys there. Oh man, I just go on for too long, guys, and then you just pile me up with questions. Give me a sec. All right, I'm going to go a little faster here. Please tell me the benefits of tablets having vitamins B1, 6, and 12. B vitamins are beneficial, help with methylation, help with stress. I got to move on fast, though. Gabe writes in another question of my father-in-law found blood in the stool. What could it possibly be? Well, on the low end, it could be like a hemorrhoid, right? There's just some hemorrhoids. Those veins on the outer rectum are just inflamed and some blood's coming in, the outer anus part. It could be an ulcer or some type of lesion in the gut on the low probability side. I mean, the question is he burping up blood or is it just in the stool? What's the frequency? Get a blood test. See if iron is going low. Get an RBC, hemoglobin, hematocrit, get a ferritin, get a UIBC, get a TIBC, get a reticulocyte count, and then you know. Did you enjoy water skiing the other day? Yeah, I did, Spivey. Thank you. I was out Friday and Saturday. I'm going Sunday morning. It's phenomenal exercise. Thanks again. I got to post some videos soon. If you follow up to the keto discussion, why are people okay with stevia? Does it still create an insulin response? Do you think juicing is overrated? Awesome question, Noah. Actually, Dr. Berg did a great little study on his Facebook page where he had all the people on his page test their blood sugar and test it according to stevia. And they found there was no correlation with blood sugar raising with stevia consumption. Now, a couple caveats. Number one, I recommend don't do it all the time. Make it a sparing kind of treat, not an everyday kind of thing. Number two, make sure the stevia does not have maltodextrin and corn sugar in it because number one, there's going to be GMOs in there if it's not organic. Number two, that's sugar. So you got to make sure it's a clean version like a stevia sweet leaf or a good quality that does not have additional sugar. So I would say you're pretty safe based on Dr. Berg's clinical research on that. Good. Tiffany writes in, thank you. Josh writes in, what would you recommend for someone with gastroparesis when eating fat, especially good steatocrit on GI map? I would recommend ginger tea. I would recommend HCl and enzymes to tolerance, and I may recommend some additional motility support like Iberagas or Motil Pro. Do you need to be in ketosis to trigger autophagy? Great question. So number one, I would say part of autophagy is you're going to have to be in ketosis because part of autophagy can happen through fasting. Now, when you fast, you're kind of in ketosis just because you're starving the body. But when you're also in nutritional ketosis, that's like you're getting enough nutrition, but your body's tapping into fat. I like that better. So you can do a combo of a fast or an intermittent fast or that. I would say yes, I think you have to be in that type of a metabolic state, but I cannot guarantee it. Noah writes in, have you heard of the drug Xifaxan for leaky gut? Surprise, some ND falling for a pharmaceutical. Yeah, Xifaxan, another one called rifaximin. It's the same thing, rifaximin or Xifaxan. The benefit of that antibiotic, it works. Typically, they use it with neomycin as well for SIBO, 14-day protocol. A lot of times it costs about $1,000 for a 2-day protocol or 2-week protocol. And the good thing about that antibiotic, it does stay more localized, so it doesn't go systemic. But I mean, I always like the herbs first. I'm biased towards that. There's some research finding that they're more effective. So try the herbs first before you go to that. Is acupuncture good for back pain? Yes, but get to the root cause. Dr. J, what do you think about bitters for digestion? Think they're great. Ginger, gentian, anise, orange peel, great. Love the idea of the upstream approach. Totally. Glad you like that, Wild Dove. Lipase enzymes versus ox bile. Which one should I use? I have gallbladder, but I'm not digesting fat. So like, for instance, how I structure it is I give HCl and I give enzymes separately for anyone that has digestive issues. If we see a floating stool or we see really difficulty digesting fat or we don't have a gallbladder or we have a history of sluggish gallbladder, we'll add in herbs that help with thinning out gallbladder, like milk thistle, or I should say more dandelion and fringe street and artichoke. And then we'll add the ox bile in too. So we'll add my liver supreme in. My enzyme synergy has some lipolytic enzymes in it. So typically the HCl, the enzymes, and the liver supreme tend to be the combo you need if you have a lot of fat digesting issues. You're welcome, Michelle. James writes in, what's your favorite nootropic for everyday energy? I mean, honestly, I would just say for me, I saw Steve Folks speak a few years ago at a Bulletproof conference. He just said like the easy low-hanging fruit nootropic that people just forget about. And I use my Mito Synergy, just B vitamins and mitochondrial nutrients. I mean, very, very simple. Now, if you're going to go up, I mean, you can go into a piracetam's nice. It's a water-soluble racetam. PQQ is great. That kind of falls into the mitochondria realm as well. And one sec. And adaptogens. Like, I mean, I'm a big fan of ashwagandha, rhodiola, ginseng, eleuthero. I mean, I think these are just really good ones. Helps modulate stress. That's my low hanging fruit. I mean, you can go into like citrulline, alpha GPC. You can go into these type of things, but I mean, I think this is the low hanging fruit. Okay. Please tell me your Facebook account. Okay. Shallow, go to facebook.com/justinhealthwellnessclinic. Cassie, is acupuncture good for severe back pain? I think it is. You have to get to the root issue. A lot of times there's adhesions, there's joint motion issues, there's postural issues. So if you're just using acupuncture needles to help improve chi force and improve inflammation or reduce inflammation, that's good. You have to make sure the root underlying issue is addressed. So a good applied kinesiological chiropractor is the way to go. Dr. J, could you repeat the brand of your cell phone EMF protection? There's many on Amazon. I like reading it. Q-Link. Q-Link's the one that I like. I've been using it for about 10 years. Does it work? I mean, there's some decent research behind it. And 20 or 30 bucks, 50 bucks. I mean, is that worth it? Yeah. I mean, I'll invest that kind of money all day, even if it just gives me a little reduction. Have you heard about the Stasha Gomanak? Her talk about vitamin D, sleep, B vitamins is amazing. Have not. Feel free and shoot me the link to office@justinhealth.com. Love to see it. Josh writes in, I have high chemical toxins in the GPL, 1 bromopane, halopropane, no obvious exposure routes. Any suggestion on what to do besides GSH, imagine glutathione, sauna, etc. Yeah, I mean, a lot of those things, a lot of the stuff on the GPL tox are going to be pesticide residue based or gasoline residue based. It's going to be hard. If you know there's an objective thing in your life that you're getting exposed to it, hey, then do your best to change that. But yeah, sweating, glutathione support, phase 1, phase 2 detoxification nutrients. In my line, it's liver supreme or antioxidant supreme, and then detox aminos. That's mine. And then, of course, you can always add some binders into. Couldn't understand what you said. So Facebook link is facebook.com/justinhealthwellnessclinic. Click below the description of the video. It'll be there, actually. Roshan writes, I noticed a few times full spectrum digestive enzymes increased burping after 2 days of use. Any way to explain that? I felt improved carb/sugar breakdown due to the enzymes. I would make sure you also add in some HCl, and I would also maybe add in some bitters too, and then taper the enzymes up. Start low, work them up. Make sure you take them in the middle of your meal, and then make sure if you have digestive issues, really make sure nothing's raw, cooked, pre-digested. And if you're really having those bloating issues, go low FODMAP, cut down the fermentable carbohydrates. Hey, Sam, lots of gardening around this time. What do you do about detoxification from Roundup if exposed? What are your recommendations? I mean, I would do the phase 1, phase 2 support, antioxidants, sulfur supporting amino acids, and then you can even just have a little bit of glutathione on hand. Try not to use Roundup if you can. I mean, the company that I hire is called Chem Free Austin, and they have a lot of Roundup-free alternatives. And if I have to use a pesticide, we spot it. It's like, boom, that's it. We're not going to like cover the whole yard, right? It's very, methodically spotted, and I try to avoid the Roundup. And then, of course, if I do need something, we're making sure we're not in the yard for a couple of days afterwards. But for the most part, like we had a neighbor across the street use a ton of Roundup, and they just blanket their whole yard. So we really try to decrease the exposure. And I do see people in the GPL tox test come back with Roundup. So it is definitely an exposure issue. Spivey writes in, I have swelling on both sides of my throat. What could that be? I mean, I would look at Hashimoto's. That'd be the first thing I would look at. Vitamin B12 injections improve my balance every time I take them, but they give me acne. I mean, I would look at doing a good quality sublingual B12, methylated B12, or a hydroxyl or adenylyl B12. And I would look at getting the gut fixed, because if you have issues with that, there could be some gut issues. All right, guys. My wife made me a phenomenal lunch here. I'm going to go dig in, and I got patients in 40 minutes. So thanks for checking in with me, and I'll be back on Monday, and I'm on my Thyroid Summit kick. So make sure you sign up to get more info. Last question. Any great supplements for hypertrophic cardiomyopathy? Yeah, all the nutrients to make the heart work better. CoQ10, B vitamins, carnitine. You can do creatine. You can do B vitamins. All that's great. Oh, man, I answer one question before I go, and I get a whole bunch. All right, this is it. Jeff, I'm out of GI Clear 1 and 5. What do I need to take for H. pylori that may knock it out good? There's been a lot of family stress. Golden Seal maybe. So Golden Seal's in my GI Clear 4. I just see you cancel your appointment next week. So make sure we get on so we can chat more. But finish the herbs. If the symptoms come back after you finish that, I would be on GI Clear 4 for sure. And then just a lot of healing, soothing nutrients, a lot of charcoal, and don't dose it up too hard. Your biggest issue is you go too hard and you hurt yourself. Find a dose that works every week. Push it up one, push it up one. Good binders in place. Thanks, Sam. Have a good weekend. What do you suggest for chronic level pain relief for autoimmune? Chronic level pain. I would get on an autoimmune diet first. Autoimmune diet, collagen peptides, liposomal curcumin. That's your first good step. All right, guys, I'm out of here. Have a great weekend. Take care. Bye.